The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan. It's a pleasure to be hosting the podcast, and thanks to everyone for listening in. Today's topic is going to be a bit of a complex one, and we'll probably go a little longer today. It involves the recent CMS announcement of Star Year 2025 ratings and results. And so every year, CMS grades contracts or health plans on quality measures. And there's about 40-some measures roughly that CMS rates Medicare Advantage plans on, as well as PDPs. But today we're mostly talking about Medicare Advantage plans. And these 40 measures are a mix of clinical measures, more complex clinical measures related to readmissions and transition of care, drug measures, member satisfaction known as CAHPS and HOS, as well as how well you improve throughout over year to year, as well as operational metrics. How do you run your health plan in terms of call center and complaints and disenrollments and things like that? So all of these 40 plus measures sort of come together. You get a score of 1 through 5 on each measure, and then you get an overall rating. And that overall rating can span from 1 to 5 in half-point increments. And this is how essentially CMS grades the quality of your plan. They put this rating on the Medicare.gov website. Plans are required to advertise what their rating is so that plans know how high the quality in that contract is. And most importantly, these ratings also give you more dollars in your rates. We're not going to really be talking too much about rates today, but it impacts your rates in two ways. There's something called the rate rebate, and that is the difference between what you as a Medicare Advantage plan bid for the regular Medicare benefit, and you get a percentage of the difference between what you bid and the county benchmark for the contract counties that you're in. And the higher your star score, the more of a rebate or a payback you get. And so if you're just a 3-star plan, you're only getting 50%. But if you get 3.5 and 4, you get 65%. If you get 4.5 and 5, you get 70%. And then the other way a star rating helps you is if you score 4-star or greater, you get 5% added to your county benchmark. So you get roughly 5% more, although that's discounted a little bit. So those are the two ways, the rate rebate and the quality bonus, that you get additional dollars if you score really high on these star ratings. And then, of course, if you get a 5-star, you can enroll throughout the year. And in general, the higher your quality rating, the more chance that you're going to get enrollment at any time, because seniors and those with disabilities that are in Medicare tend to be pretty savvy. They tend to flock to higher performing plans out there, those plans that are 4, 4.5, and 5. So that's just a quick explanation of the star rating system and why it matters. I'd like to note here that this podcast is really a collaboration between my Healthcare Labyrinth website as well as Lilac Software, which is a new data analytics technology firm that I co-founded with Neetu Rajpal and Alex Schaefer. We're growing fast. We're building out software. Our first data analytics dashboards and software technology focuses in on STAR. So some of this data that you'll hear today was done by Lilac's data scientists. And they are hard at work analyzing all the STAR Year 25 results and also recent trends. So you can check out Lilac Software's website for additional research and analysis. by searching or Googling lilacsoftware.com, as well as go to Lilac's LinkedIn page and again, search for Lilac Software. So that will give you the most up-to-date information from Lilac Software. And again, we're growing swiftly. We're building out our platform and we're beginning to work with clients. So we're very excited by the potential for Lilac Software moving forward. And you'll hear an ad later during this podcast about Lilac Software as well. So with that said, let's get right into Star Year 25, the results. And I'd note that while the Medicare Advantage STAR program has always made it difficult for plans to achieve and maintain high STAR scores, the STAR roller coaster ride that we've been on recently has been much more profound over the past several years. We now, based on the 2025 STAR year results for Medicare Advantage, are seeing 3 years in a row of falling results, which are the 23, 24, and the 25 STAR years. In some ways, the 23 year was a return to normalcy, and I'll give apologies to President Warren G. Harding, after banner STAR ratings in the 2 years prior that were driven by COVID flexibilities. What do I mean by COVID flexibilities? Well, during the COVID pandemic, CMS created fairly major calculation allowances for both STAR 21 and 22. These allowances had the effect of boosting STAR scores really artificially. So we saw a surge in STAR scores in 22, including for plans that historically did not have a great track record of consistently hitting 4 stars and above. However, for 2023 STAR measurement, almost all of those COVID calculation allowances were lifted. And we saw a huge drop in STAR achievement. In STAR 24, more drops occurred and volatility occurred because calculations saw more changes, including implementation of what's known as the Tukey outlier formula. We'll get a little more into that as well. And far more complex measures that were added in that year. So now in STAR year 25, we see further reductions as remaining Tukey outlier latency rolled out, and further measure attainment also appeared to increase as utilization returned post-COVID. But many plans did not keep up with their peers and thus saw lower measure ratings and overall ratings as well. So that's just a brief overview of what happened with the COVID allowances. And when we came back, many plans were shocked because things got a lot more complex and they lost a little diligence in there. And what I really want to note here is if 23 STAR year was a return to normalcy, we now really, even though 23 fell a bit, we now clearly have 2 years, STAR year 24 and 25, of what I would call very bad news. The percentage of MA Part D or MAPD contracts hitting 4-star and above, as well as the percentage of enrollment in the high-performing contracts 4-star or above, is extremely low and have now dropped well below pre-COVID levels. The percentage of contracts that rate 4-star and above barely broke 40% for STAR year 25, down from 44% in 2024, and that, again, was already somewhat low. Enrollment in 4-star and above contracts has now slipped to just over 62% from over 76% in 2024. So for the first time as well since 2015, the average overall score across all the rated contracts has now dropped below 4 to 3.92. That's very, very significant and very, very troubling. Again, if you look at the pre-COVID base years of 2019 and 2020, the 2025 results are markedly lower in terms of really almost every metric we look at. The average score is much lower. The number of 5-star plans is much lower. The percentage of 4-star plus contracts, as I noted, is much lower. And enrollment in those 4-star plus contracts is much lower. Again, the fact that just 40% of contracts and 62% of enrollment is in 4-star and greater contracts is especially concerning. These figures, 40% and 60%, are very much driven by reductions of what I call overall star power at the big national plans, which control over 3/4 of all enrollment in MA. Generally speaking, most of these plans have done pretty well over the years, especially United, Humana, and CVS. There's been a couple bumpy years, but generally they dominate, enrollment, those three plans. And they've done pretty well by and large. But that's not necessarily the case anymore. In star year 25, Humana had the biggest decline. They went from 94% down to about 25% in 4-star or greater contracts. So Humana had the biggest drop among the big plans, but there were other big drops as well. For example, United went from about 80% in 4-star contracts or above down to 68.5%. Elevance Health, another big player, went from about 53% down to 40%. I would note that CVS Health stayed pretty much the same, 91% in 4-star or greater plans down to 88. And Cigna stayed pretty much in their Midland area, about 69% in 4-star or greater plans down to a little under 69. So they stayed about the same as well. I would note that Centene, another big player, has consistently had problems getting to 4-star and greater. So they basically, in the last 2 years, including 25, have really had nobody in 4-star or greater plans. About the only entity besides CVS that maintained, roughly 88 to 90% enrollment in 4-star plans, Kaiser Permanente probably was the only other one that did very well. And they went from 81% roughly in 4-star or greater plans to 100% in 4-star or greater plans. But in general, what was really driving that 40% of contracts reaching 4-star and above and 62% of enrollees getting in plans in 4-star and above, those bad statistics was really driven by these problems with the big national plans out there. They really have lost, for the most part, their good bearings on star scores. They've lost touch with what needs to be done. And it really, really impacted results rather phenomenally. With that, let's take our first break. And when we return, we'll dive a little deeper into why star year 25 results for Medicare Advantage plans were so lackluster.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this edition of the Healthcare Labyrinth podcast. We're talking about the 2025 star year results for Medicare Advantage plans, largely focusing here on Medicare Advantage Part D statistics. Well, again, here are some, additional reasons about why things did not go so well. So number one, we talked a little bit about COVID flexibilities, and it's very clear that 21 and 22 were clearly artificial star ratings. Given those COVID flexibilities, ratings sort of surged, And it's very clear to me that CMS, the Centers for Medicare and Medicaid Services, should not have had policies that essentially led to ratings inflation. Part of that ratings inflation allowed plans to drive up benefits because they had artificially high scores. And those benefits were clearly unsustainable, as we're seeing in 2025 now. So that's just sort of one factor. The 21 and 22 rates were so artificially higher. Number two, again, let's stick with the COVID pandemic theme here. The virtual suspension of STAR rules during 21 and 22 allowed plans to take their eyes off of STAR, as I sort of alluded to when we were talking about the big plans. And that was very short-sighted for plans that did. The lack of discipline likely has impacted their recent scores. It's very, very hard to rally an operational enterprise around this very sophisticated and complex program. And when you take your eyes off it and you don't have when you have a lack of discipline, clearly you're going to suffer in your STAR results. And that's what we're seeing here. It's very hard to get back into the groove of STAR when you take your eyes off the STAR prize here. We do know that some plans did not take their eyes off of it, and they came out of the pandemic with continuing high ratings. So they should be congratulated for really their diligence and their foresight. Third, some MA plans are arguing, and I buy some of this, that quality really is not going down. Quality is still going up, and it's just the ratings that are going down due to the higher bar each year. And again, I don't dismiss that out of hand. To some degree, that could be true. And I would also say there is no doubt for me that MA plans do a better job than the traditional fee-for-service program in terms of delivering quality in so many ways. I would also note that at least some of the sluggishness in ratings can be tied to the introduction of more complex measures, weights that are changing, and other tightening, such as the Tukey outlier, which we mentioned earlier and we'll go into in greater detail. While you could argue with the changes, I would also say that CMS is right that the purpose of the STAR program is to continue to drive quality. Plans clearly are having issues with keeping up with the changes, including performing well on new measures. CMS telegraphs the changes via display measures, which sort of tell you what ones will likely come up into STAR ratings over time. But too few plans are tracking and remediating these measures before they get promoted. And so that's a big issue with some of the poor ratings as well. So just some of the reasons for why, we saw a decline here. I will note that plans will continue to see these challenges given the roadmap CMS has assembled. The Health Equity Index is slated to award just 0.1 of 0.4. That's from a recent study by Milliman. And this is down from the annual average across all contracts of an award of 0.3 of 0.4 from the retiring reward factor. The Health Equity Index comes out in 2027. And next, measure year 24 and start year 26 saw the first true NCQA electronic measure in STARS known as ECDS. This is for colorectal cancer screening. Yes, breast cancer screening converted to ECDS in 2025 STAR year, but it really isn't a hybrid measure. Colorectal cancer screening is very reliant on chart gathering. And beginning in STAR year 26, you can no longer use manual chart reviews. It all has to be electronic. So beyond the health equity, the conversion to what's known as electronic ECDS measures will also create major problems for health plans. And in STAR year 27, we have 2 new drug measures, and we can expect more of this in the future. And I would note that drug measures have been very tough for plans to achieve on, and some of them are triple weighted. So those are just some examples of why life is not going to get any easier for plans in the future star years. It's only going to get a little bit harder. So let's look at some more analysis here. And I'm pulling from the great data science work from Lilac Software's data scientists here. One key finding from the data scientists is how performance has changed among high, medium, and low performing plans over the past several years. For the purposes of their analysis, the Lilac data scientists bundled high performers as those that achieve 4.5 and 5 stars on their contracts. Medium performers were bundled as those that receive 3.5 and 4 stars on their contracts. And low performers were bundled as 3 stars and below for their contracts. We found that the number in proportion of 4.5 and 5-star plans, the so-called high performers, has dropped dramatically from 2022 to 2025, going from 168 contracts in 2022 to 92 in 2025, a 45% reduction. For 3.5 and 4-star plans, the so-called medium performers, the count has actually increased from 268 in 22 to 277 in 25, but the proportion of overall contracts decreased over the time frame. For 3-star and below plans, as you can imagine, the count has increased for these low performers from 27 in 2022 to 146 in 2025, which is a 441% increase. The proportion of overall contracts increased dramatically as well. So you can see from 22 through 25, from that peak to now, you can see the number of high performers has dropped dramatically. The number of low performers has increased dramatically, while the count on medium performers has gone up a tiny bit. The proportion of even those medium performers has decreased over time as well. So really very dramatic shifts downward since 2022. Here's some additional observations from CMS that I'd note. So they talk a bit more about Tukey, which is this outlier formula that was implemented. In 2024, CMS implemented this Tukey outlier, and essentially what it does is it takes outlier performance at the very bottom and at the very top from the sort of clustering that's done for most measures. And the effect that tends to have is it makes it harder to achieve higher star scores, in essence, because most of these outliers are at the bottom, the poorest performers. So if you take those outliers out, the benchmark for 1, 2, 3, 4, 5, when you cluster, tends to change and move up. So the Tukey outlier for a number of different measures made it much tougher to end up with high performance. In essence, this Tukey outlier resulted in an upward shift in cut points to, again, more accurately measure performance. I would add that Tukey could have outlier impacts each year based on the outlier performance. Probably not profound, but every year, depending on your outliers, Tukey could impact. But since this was impacted in 2024, and a court mandated that CMS follow the guardrails, which generally mean cut points cannot move more than 5%, a court said they had to continue to honor that regardless of whether Tukey was being implemented. Not all of the Tukey outlier implementation was implemented in star year 24. There was what I call a latency. There was some leftover movement in the cut points that was now allowable that, could be built into the 25 cut points. And that indeed did happen. And thus several measures had cut point impacts greater than 5% in 24. And therefore that Tukey latency, that I call it, rolled out into the star year 25 as well. So that complicated plan achievement too. CMS also talks about returning utilization, and I clearly noticed this in analyzing the results. CMS notes that for some measure, performance is returning to pre-pandemic levels. I actually saw it go even beyond that to even beyond historic levels, this resulted in some increases in cut points too. The agency also says that some lower performing plans did better on certain measures and pushed up the cut points overall. Again, if you do better at the bottom, things get to be pushed up. In other measures, CMS saw just high scoring plans driving the highest cut points. But overall, what we're saying here is that utilization is bouncing back from the COVID pandemic. People are now getting back into the health system. And so results are coming in better. People are getting tests. They're going to the doctor. And whether you're a high or low performing plan, we tended to see, even outside of the movement and cut points for Tukey, we saw cut points moving because utilization was returning. Now, again, that does not mean that every plan would then see an increase in their STAR score. Just because their value and utilization in a measure may have increased does not necessarily mean they have a higher score in that measure or overall. And that's because even if they got better scores from 24 to 25, if they did not keep up with their peers, their score in measures and the overall score could actually drop. And that's exactly what we saw. We saw many plans, even though we saw this recovering utilization and recovering values in stars, they saw their overall stars drop and measure scores drop because they did not do as well as the contract population overall, if that makes sense. Another thing that CMS also notes, and this is very true throughout every year, they looked at profit status of plans and their contract scores and tenure of plans and their contract scores. And what they found, as usual, is that nonprofit entities do better on overall STAR scores than for-profit entities. In terms of for-profit entities, just about 36% of contracts and 50% of enrollment are in 4-star or greater contracts with for-profit entities, whereas for nonprofits, those numbers are 56% of contracts and about 82% of enrollees in 4-star or greater contracts are associated with nonprofit plans. So that's an interesting phenomenon. And again, that's been rather consistent over the years. In terms of tenure, it stands to reason. The more years you have in the program, the greater the likelihood you achieve 4-star or greater ratings. So with that, we will take our second break and come back and continue our discussion regarding STAR Year 25 measures. And we'll turn to the average measure scores. Where did things go well and where did things not do so well? Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast, which is being done in collaboration with Lilac Software. You just heard the ad for Lilac Software, a new firm that I co-founded with Neetu Rajpal and Alex Schaefer that is dedicated to helping plans on the data modeling, data analytics, and insights front. And it's a technology-based company, and we're building some of the best technology out there for data analytics using AI and machine learning. And we're hitting the ground running. So you can learn more about that at lilacsoftware.com. So let's get now back into Star Year 25, and we're going to talk a little bit about average measure scores. At the beginning, we told you that the number of contracts that had 4-star or greater, as well as the number of enrollees with 4-star or greater contracts, dropped dramatically. And part of this is what we outlined tied to the COVID pandemic and plans losing their sort of insights and drive to get to high star scores. And we can see that in the results of the average measure scores for each of the 42 Medicare Advantage Part D measures in Star Year 25. Just to refresh your memory, there are about 30 Part C measures and 12 Part D measures. The overall 42 number will increase moving forward because more measures are coming out. But there were 42 MAPD measures, 30 Part C and 12 Part D. So let's look at these in both Part C and Part D here. In terms of Part C measures from 24 to 25, 11 measures increased, 6 stayed the same, and 13 dropped. So about, a good share went up, a good share went down, just 6 stayed the same. Poor performing measures in Part C include osteoporosis management at a 2.7, reducing the risk of falling at 2.6, controlling blood pressure at 3.0, improving blood control, which got a 3.0, statin therapy for cardiovascular disease at a 3.0, and transitions of care, one of those complex clinical measures, at 3.0. High-performing measures in Part C included care for older adults, medication review at a 4.1, care for older adults, pain assessment at a 4.2, complaints, which is really 2 measures in Part C and D at 4.2, appeals, timely decisions at a 4.2, and the call center at a 4.2. So those were sort of the results for Part C. In terms of Part D measures, 5 measures increased, 1 stayed the same, and 6 dropped. So of those 12 measures, what are the poor performing measures? Well, they include statin use at a 2.8, and the high performing measures include call center at 4.0, and again, complaints, which is both a Part C and a Part D measure, at 4.2. Of note is that the 3 medication adherence measures were all 3.2 or 3.3. So they were at the lower end of the average. And this, again, is a big problem area for plans because these medication adherence measures remain 3 times weighted. So we're going to shout out a little congratulations to the 7 MAPD plans that received 5 stars on a contract in 2025. It is a very select group right now because the number of 5-star plans has dropped from 38 in 2024. So Alignment Health Plan, one of its contracts is 5-star rated. HealthSun Health Plans by Elevance Health got a 5-star rating. One of Highmark Blue Cross and Blue Shield plans got a 5-star rating. Leon Health Plan, their contract got a 5-star rating. Congratulations to them. They are a relatively new plan. They launched a few years ago and now have 2 years of 5-star ratings. MCS Advantage Classic Care in Puerto Rico, that's one of MCS's plans, contracts that got a 5-star rating. Network Health Medicare Advantage plans, they have a contract with a 5-star rating. And Optimum Healthcare by Elevance is also a plan that got a contract with a 5-star rating. Let's talk a little bit now about the impact on bonus payments because this is fairly important. For 2015 to 2023, we saw a consistent rise in the star quality bonus payments. Again, this is the payment for plans that get 4-star or greater. We already saw a drop in star quality bonus payments from 2023 to 2024 of about $1 billion. Because of the 2023 to 2024 drop, that quality bonus payment went from $12.8 billion in 23-star to $11.8 billion in 24-star. The average bonus payment per enrollee dropped from about $417 for 2023 star to $364 in 2024 star. I would note that actual impacts to the quality bonus payments for star year 25 is dependent on each contract's rating, enrollment, county benchmarks for the coverage area. So I have made a few assumptions and have estimated a potential reduction which is greater than it was from 23 to 24. I expect from 24-star year to 25-star year that there's a potential reduction of about $2 billion in quality bonus payments. Again, it could be a couple $100 million less, it could be a couple $100 million more, but it's right around that $2 billion number, which again takes into account fewer 4-star or greater contracts, but I have put some enrollment growth in there too. I call this directionally correct, given all the variables. Remember, too, that plans that slipped from 5 or 4.5 to 4 and 4 and 3.5 to 3 or less also lose dollars from the rate rebate advantage that we talked about. They're going to go from potentially 70% rate rebate to 65% or 65% to 50%. That would be on top of the $2 billion calculation that I just talked about in terms of the quality bonus reduction estimate. With that, we will take our last break and we'll come back with some concluding remarks. Stay tuned.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. This one is being done in conjunction with Lilac Software, a new technology firm for data analytics and data insights. And you can learn more about this new firm that I co-founded with Neetu Rajpal and Alex Schaefer at lilacsoftware.com. So what are the conclusions here? Well, Star Year 25 continues this theme that star achievement remains a huge challenge for plans big and small. COVID allowances led many plans to be complacent in a key revenue and competitive advantage area. That continued into Star Year 25. Plans lost focus and may have not rebounded. What many plans fail to appreciate, too, is the long tail of star. What do I mean by that? The 40-plus measures for MAPD plans are a curious concoction of clinical, survey, and plan performance measures. Data used to calculate a given star year may be 1 year back for CAPS and 2 years back for Haas surveys, clinical measures, and plan performance metrics. Within the HEDIS clinical measures, the look back for compliancy can add 1 or 2 more years as well. Once you get a star score, it does not impact your revenue until the next year. So what you did a year ago and do today impacts your star score and revenue well into the future. What's more, plans have to be working multiple star years at once due to this lag and the need to perform best in star. The point here is that MA plans can never lose focus on the program or they risk huge fallout well into the future, probably for multiple years. That's exactly what we're seeing here coming out of COVID, and it could very well continue into STAR year 26. Many plans lack the technology, clean and timely data, and expertise to hone a consistent and high-performing program. They also lack the agility to respond to CMS changes in the STAR program. Technology to analyze and keep tabs on all the years, measures, and formulas is key. The STAR year 25 results signal continued tough financial times moving forward as well. For calendar year 25, the industry overall was looking at lower STAR revenue and no real rate increase due to the rollout of the new risk model. That model continues to roll out in rates, which means another relatively flat year in 26. The STAR year 25 results impact revenue in 26 because of the one-year lag, which could again contract STAR revenue in calendar year 26 because of the 2025 STAR year results. The 2025 STAR results, too, will lead to a fundamental reassessment in Congress and at CMS as to what is going wrong. The fact that just 40% of contracts and 62% of enrollment in 4-star plus contracts is especially concerning, as I've said. That less than 2/3 of enrollees are in highly rated plans could lead to Congress and CMS asking whether the additive nature of STAR dollars should continue and might enliven debate on a major rework of the program. We know that MedPAC, the congressional policy arm for Medicare, is especially keen on changing the program in many ways. This might be the excuse for Capitol Hill, CMS, MedPAC, and others to at least begin looking at reframing the STAR program. But let's end with what I think is a positive note after all this doom and gloom about falling STAR scores. And again, plans are going to have a hard time seeing my positive note here, but I do believe it's positive. As I alluded to earlier, the STAR rating program is meant to be a continuous quality improvement program or process. We have such challenges on the cost and outcome front in healthcare that we cannot rest on our laurels and not continue to drive performance. In the end, that to me is what STAR is all about. So in many ways, STAR is working. Even with scores dropping, the bad marks we were seeing in 24 and 25, the criticism of Tukey and cut point surges and more. STAR scores dropping can be seen as a sign that the STAR program is doing exactly what we want as a nation and what CMS's STAR mandate is for MA. Good quality care for members at a lower cost and increasingly better quality over time. So, while there surely would be more turmoil as a result of the 25 announcement, we should keep this in mind and celebrate a commitment to quality. Plans need to meet the challenge. With that, we'll conclude this edition of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.